I'd like to now welcome our first guest, Dr. Jonathan Weiss, founder and CEO of HealthEngine, onto the program. Good morning, Jonathan.
Good morning. Thanks for having me.
How are you? You coming from cold Chicago today?
Chilly Chicago, yes, but somewhat sunny, so we'll take that this time of year.
Jonathan, you're doing some really interesting and exciting things. That we on a lot of these segments we talk about transparency, we talk about bringing consumers together, and you're coming at this from a unique physician point of view, and you've got a very interesting background too. Kind of talk a little bit about your background and what you're doing with HealthEngine, and then we'll talk more about it.
So I'm one of those odd birds who did medicine. I'm an MD, and also did business, and decided to go out on the entrepreneurial route, and firstly built a hospital system that competed and became one of the largest private sector providers contracted to the National Health Service in the UK. And those were really bundles that were being purchased over multi-year contracts where you had to go out and really deliver the full solution, build the hospitals, hire the staff, put in place clinical governance, and then offer a price for outcomes and be value for money. That was sold in 2007, and subsequently set up two more businesses internationally, which have now become HealthEngine here in the States, and have done what we've done for the last 9 years in the sense of what we're currently undertaking here.
Jonathan, I want you to kind of talk more about this business model you have and
Sure.
the solution. But I think you have an interesting comment too, where you say, "Why is healthcare consumerism a myth?" Talk about that a little bit.
Well, that's a little tongue in cheek. The myth hasn't become a reality yet to a great extent or to a meaningful extent, because what we've really been saying to people as consumer-directed healthcare has made its foray is, good news, you're now sort of shopping for healthcare services, but you're in the dark. You don't know what you're really looking for. There's a lack of information. That started to improve really at the advent of transparency, which was a great advance coming into the fore of the last 5 years, I'd say. But there's still this disconnect, I think, between the consumer, their plan, and the other most important counterpart besides the patient being the physician. And
Yep.
So our whole mission is to serve the patient, give them access to all the information they need, be agnostic, not talk about networks or, contracts, but let the market compete for choice opposite the individual who's making a consumer decision, but in the presence and support of their choice partner being their trusted physician most times. And that's where we think you've really got to get to catalyze true consumerism.
Yeah, I think and Ron, you can jump in here. I think Ron and I would both agree with you that we can't just turn the light bulb on and say, hey, we're all consumers of health and healthcare, because we've never had to try to figure it out before. And emerging solutions like yours and decision support marketplaces like yours are absolutely much needed. Ron, you agree?
I do. And I've always said I really don't like the term consumerism, although we've kind of stuck with it. People don't consider themselves consumers when they're dealing with healthcare. They all consider themselves patients, but the media has picked up and promoted the term consumerism, so we tend to use that. But Jonathan, could you tell us a little bit more about how does HealthEngine really work? What does it do? And our listeners are always interested in better value and lower costs. How do you get, as I think sometimes you state, you get savings beyond the health plan negotiated?
Yeah.
How does that work?
Sure. So, there's a lot of competing products and services out there, but what we're really trying to deliver is a solution. And we believe that if you're offering a solution and you're backing it up, you're the ones that do what you do, you should do that and take risk in perfect alignment with the patient, the plan, the insurer, if it's a fully insured sort of policy. And so HealthEngine, first and foremost, is a free-to-use technology and concierge platform. Concierge because, like we were just saying, a lot of people still don't even know what the difference between a copayment or a coinsurance is. So tossing them in the water with a lot of pricing variation and quality metrics before they even know how that impacts them in terms of their plan is sort of the deep end. What people have access to is this platform, and they can call the concierge service. They see every provider thereabouts in the country, every physician, every facility, every hospital, lab, imaging center. And moreover, they have instant access through the platform to where they are in their benefits so that they can be walked through, where maybe their child has already spent part of the deductible, what all this means in terms of cost, quality, which we can touch upon in a bit, and then service and sort of putting that together alongside their physician if they want to have them participate. Where we, on the other side, interact is we engage firstly with docs on the clinical side. That comes first. And we set out the ability for all providers who are qualified, accredited, and licensed to claim their profile for free. It never costs anything for a provider either. And basically, we have information that we will have populated about you based on hundreds of millions of claims level detail over the years we've been sorting through and mapping out. We'll have information on referral patterns, what kind of, cases a center or physician might concentrate on, volume outcomes, all the sorts of information we would think or believe at this point that patients and physicians might want to make use of. What we also say is, tell us more about you. Tell the consumer, here's your stage, the light's on. Are you, a designated center of excellence? Have you just completed a certification? If you can validate that, we'll put it up there. We'll let the consumer or the patient, as you say, see that alongside their physician. Here are your rates. Yep.
Jonathan, I want to give you a chance. Go ahead. I'm sorry, Jonathan. Go ahead. I
Here are
apologize.
the rates. No problem. Here are the rates by allowable or the actual rates your plan has agreed for, hundreds of services and increasing. And this is where the prices, can get a lot better. We say that's the worst case today if you walk in with your Aetna or your Blue Cross card. The providers through HealthEngine can, if they want, not only compete on quality, but they can say, now that I know that I'm live in front of coming on 2.5 million people that have access to the platform now, I want to offer better rates if and when I can turn those on and off or increase utilization in my facility and sort of really get supply and demand working. That's where savings can come below the negotiated rate, and it still goes through your carrier. So it's not a cash up front bundle deal. It's the better of through HealthEngine, and that's where we make money. Only when the patient and the plan have saved do we partake in that savings.
Okay, so is that, Jonathan, I want to have you tie it back to a large part of our audience is the employer and those stakeholders working with the employer on behalf of the employer's employees. So tie back the value proposition for employers. Why should employers, come on board with HealthEngine, and then how do they get started with you?
It's easy to get started, first of all. I'll take that one right away. Again, we're free. We don't come out and push cost or PMPMs at you. We say, here's what we're providing at no cost. We're taking the risk that we can actually make money by driving rates below where they are today with the plan and do better. And so here's that platform offering all this information and the concierge service. We can give you all the engagement and webinar information, do on-site presentations, bring in local physicians. All of this is at no cost. where the plan or the employer wins is, first and foremost, now there's a tool that employees, when they become patients, can take with them, whether they're at that employer or they leave, quit, retire, are fired. And that's important, I've found, over the last nearly decade. If people think this is just for when they're at that employer and it's being paid for, they start to get nervous. They think back to, if they have a memory of this, back to the 80s and 90s, and they think, is this really good for me, and my doc doesn't really know about it? And HealthEngine solves that. We say we're physician-led, it's free, it follows you, patient, and it can benefit your employer because when you are choosing cost effectively, that saves money for your employer. It reduces absenteeism, sickness, disability from people that are sort of staying away from the doctor. It allows employers to take a fresh look at their plan. If they're fully insured, it makes the business case tremendously powerful to go self-funded. And what it also does is it enables them to touch the point of the cost curve that today is really untouchable, and that is past the out-of-pocket limit through HealthEngine. And I think we're unique in this. Your employer can agree that if you're either, let's say, at a union client of ours and you have a low deductible now, or you're going for a very costly procedure where it doesn't matter because you're going to bust through your out-of-pocket limit or you've already reached it, by still choosing cost effectively, providers will compete knowing that through HealthEngine. And if you save your employer, tens of thousands of dollars potentially, through HealthEngine that gets shared with the employee. So you've got true like-for-like alignment, and as I always like to say, there's a lot of sticks in healthcare. There's deductibles, there's reference pricing, restricted networks. Our solution is really the carrot, and it allows optimization of your existing network.
Yeah, that's great. And I think you just alluded to the tie-in with financial wellness, too. We got about a minute to go, and I want to give you a chance to kind of wrap this. And so, kind of wrap in that piece to tie into financial wellness, and then leave our audience with a couple takeaways, if you would, please.
Absolutely. Financial wellness is a concept I think that's been, it's sort of like the consumerism or euphemism of consumerism. Healthcare is still the most costly service that most people will get over their lifetime, and there's a lot of fear that is causing individuals to increasingly stay away when a high deductible plan is put in. They're not shopping so much as just avoiding care. Financial wellness in rewarding the patient for not only being a consumer or choosing cost effectively, but saving their plan money and enjoying the benefits of reduced, costs in healthcare. They get better value. They start to actually engage in all sorts of, wellness and other activities that might not directly save money, but get people involved in caring for their own personal well-being.
Yeah, that's interesting. So, any final thoughts you want to leave our audience with beyond that?
There's no solution that I know of other than allowing competition at the level of where healthcare is provided, not by insurers, not from Hartford or Minneapolis, but healthcare is local. Engaging physicians to be advocates on behalf of their patients on the cost and the quality side through competition is the lever that's going to hopefully be a solution for, the cost and value conundrum. And we're hoping to play a part in that.
Jonathan, I really enjoyed this discussion. You've done some innovative things up there, and nice to have you on the program. Look forward to a continuing discussion with you and your team, and invite you to join us down in Atlanta or IHC Forum and Expo if you can make it down there. So, and they can find you.
Sounds good.
Yeah, and they can find you at and they can find you at HealthEngine.com, correct?
You can, and we're always happy to talk further with anyone who's got an interest in delivering value and saving patients money.
Thank you, Jonathan, very much. Have a great weekend up in Chicago.
You too.